There is a disease caused by a virus in the Caribbean, Central America, and South Central Asia. The disease is prevalent. Pain behind the eye, joint and muscle pain, and rash are some of the symptoms of dengue. Sometimes it is a mild illness, but sometimes it can be fatal if not treated. So, we are going to watch about the how to prevent getting dengue fever.
Method 1. Learning about dengue fever. First is recognize the common symptoms of dengue fever.
Dengue fever may not cause any noticeable symptoms if it is a mild case. In more severe cases, symptoms will start about 4 to 10 days after you have been bitten by an infected mosquito. The most common symptoms of dengue.
Step 2. Understand how dengue fever is transmitted.
The Aedes mosquito is the main type of mosquito that spreads dengue fever. The virus is active in the blood of the infected person from day 1 to 7 of the fever phase.
Finally, consider your risk factors.
Many tropical countries in Southeast Asia, the Indian subcontinent, the South Pacific, the Caribbean, South and Central America, Northeastern Australia, and Africa. After 56 years of absence, dengue has also resurfaced in Hawaii.
Method 2. Reducing your exposure to dengue-infected mosquitoes.
First is stay indoors or under a mosquito net during peak mosquito times. The dengue mosquito has 2 peak periods of biting activity. The mosquito may feed at any time during the day, especially indoors. Make sure you sleep indoors in a screened or air-conditioned building.
Step 2. Use insect repellent when outdoors.
Apply insect repellent to all exposed areas of your skin before heading outside. For adults and children over 2 months of age, use a repellent that contains 10% DEET, N-diethyl M.
Step 3. Cover your skin.
You can reduce your chances of being bitten if you cover up as much of your skin as possible. Wear loose, long-sleeved shirts, socks, and long pants when you will be traveling.
Finally, get rid of standing water in your area.
Mosquito breeding sites include artificial water containers such as discarded tires, uncovered water storage barrels, buckets, flower vases or pots, cans, and cisterns. Help to reduce the mosquito population in your area by getting rid of.
Method 3. Treating dengue fever.
First is see a doctor as soon as possible if you suspect that you have dengue fever. If you develop a fever after visiting a region where dengue fever is common, seek medical attention right away. If your symptoms become severe, you may require blood pressure monitoring, blood transfusions, and other interventions that must be administered. Step 2. Know that there is no cure for dengue fever. There is no cure for dengue fever. If you survive the illness, you will be immune to the strain with which you were infected. You will still be able to contract one of the other 3 strains.
Step 3. Stay hydrated.
Dengue fever can cause diarrhea and vomiting, which can cause dehydration. It is important to drink plenty of water if you contract dengue. Your doctor may administer IV fluids to keep you hydrated.
Finally, reduce pain.
Acetaminophen is less likely to increase bleeding than NSAID pain relievers. Bleeding can occur if you develop severe symptoms of dengue fever.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.